Imagine going to the hospital with either a minor procedure or major surgery and then finding out you have staph infection. This happened to me between 2010 and 2011. Staph infections were found about in 1880 by Sir Alexander Ogston because he was doing procedures that had pus, and he did the blood work on them and it came back. That's how staph infections became. There's three main types of staph infections. You have a strep staph infection, you have a staph resistant, which is a staphylococci, and you also have MRSA, which is what people mainly hear of, which is your methicillin resistant staph infection. About 500,000 people in America, the United States and stuff, a year have some form of staph infection. I went in for arthritis, having to have a knee replacement, and then finding out after multiple surgeries getting staph infection. I then had a PICC line put in and was on vancomycin for 6 months. Staph infections, they don't discriminate. You can get them whether you have lots of money or do whatever you have to do. Once I found out that I had staph infections, I actually talked to several providers, nurses, attorneys, and stuff like that, and they stated that pretty much anytime you go into a hospital or a facility like that, you will have staph infections. The CDC has a 30% rate on people who do carry the staph infection with them all the time. It's either in your nose or your thorax. Staphylococcus is one of the most common staph infections of the 5 major ones that are out there. Most people who do have it have either been hospitalized before, have had multiple surgeries. I unfortunately was told I had an internal stitch that caused me to get a staph infection. I figured that the hospitals were clean enough that you wouldn't have to worry about getting sutures in your leg, but that didn't happen. MRSA and staph infections are in your system, but they can be transferred to person by just contact. Washing your hands, of course, making sure that if you are in the hospital that the doctors or nurses or whoever use gloves, wash their hands, because you're the only person that can stop any kind of type of staph infections getting into your system. I found out and almost lost my leg the hard way of just listening to a provider, letting him tell me what to do, and not really keeping my life and my health as a priority. He took it upon himself to be a world-renowned surgeon, and because he had never had a patient admitted that I was it was all in my head, and it was a lot less than what it really was. Staph infections they make you undeniably sick. You're in so much pain. And it's just not, you've got to do everything you can, any precautionary measure that you can while you're in the hospital to make sure you prevent this. Pretty much every time you go into a hospital, you'll probably have a staph infection. The best thing that anyone can say or whatever, like I said before, is make sure when you go into a hospital, whether it be a doctor's office, make sure they wash their hands. Make sure they wear gloves if they do any kind of procedures to avoid you getting something they may have passed on from person to person. I think staph infections a year is astronomical numbers as far as cost factors and stuff with patients as well as insurance companies. I personally myself in 1 year had to pay over $20,000 in medical bills because of something that I got from the hospital. So no one is ever incurable or not able to ever not say they're going to get a staph infection, because that doesn't happen. The only thing that you can do is, like I said, is make sure you take care of yourself. Make sure if you're going to go into a procedure or have anything done, you antibacterial your whole body before you go in to there, so you can at least start working on not getting any kind of infections. If you are been, or if you have been known to have a staph infection in the past, take precautions. Use antibiotics before you go in to have a procedure done.